This is Dr. Stewart from Timonian Foot and Ankle Center, and I want to talk a little bit about corns and calluses. Corns and calluses are very common conditions that affect our feet, but they're a little more complicated than I think people believe. After seeing patients for several years, I've seen that people come in and they're under the impression that we can eliminate a corn or a callus right away, and it's really not that simple. I think before we get into understanding what corns and calluses are, we need to understand what it is that our skin does. Our skin is the largest organ in our body, and the skin is a natural protective barrier. It protects us, protects bacteria from invading us. It keeps us dry from water. It really protects us when there's irritation. And a good example of what skin does is it builds up when there's pressure. So skin cells are called keratin. They're made of keratin, a protein called keratin. And if you look at someone who lifts weights, I lift weights, so I'm going to show you my hands, you can see this thickened area of skin. And this thickened area of skin is where when I grip the weights, it rubs on the palm of my hand, and I build this hyperkeratotic tissue. Hyperkeratotic means hyper, meaning a lot of, keratotic means keratin cells. So it's a buildup of keratin cells. And that's what a corn or callus is. Callus and corn, by definition, is a buildup of these cells. So let's take a look at a corn and a callus. I'm going to pull up a picture here for us. And this is a picture of a corn. And if we look at this picture, you can see that this is a buildup of hyperkeratosis, thickened skin cells, over the toe joint. And the reason it happens over the joint is because the toe is bent. And what happens is these are from pressure spots. So corns and calluses are the result of where our anatomy causes rubbing or irritation. And our skin, as I stated earlier, is a natural protective barrier. And what it does is it protects us. So essentially, if you have the finger is similar to a toe, and if the joint is bent, the top of this joint will rub inside of a shoe, and that can cause a corn. You can also get corns in between the toes when the toes rub together. When they're smushed inside a shoe, they can rub together, and that can cause a corn. A callus, on the other hand, is something that happens either on the bottom side or more often the bottom of the foot, and this is a callus. We can see this buildup of skin on this. This is the big toe up here. This is the bottom of the foot right here, and this is an area where the shoe is rubbing and causing the skin to become irritated, and generally calluses happen on the ball of the foot. So corn, again, is the name for a hyperkeratotic or thickened lesion that happens on the top of the foot, whereas a callus is something that happens on the bottom of the foot. And they're really the result of our anatomy. So our anatomy is such that we're getting irritation or rubbing, and we're getting this buildup of skin. Now, in patients that have normal sensation, these are very painful. They make wearing shoes uncomfortable. They can also happen over areas of bony prominence, not on the ball of the foot or not over a toe. Sometimes in the arch of the foot, people will have a prominent bone called an accessory navicular bone that can cause a callus buildup. But basically, whenever these areas create pressure, wherever there are areas of pressure, you can get pain. And the simple way to treat these areas to reduce pain is to shave these calluses or corns down so that there's no pressure. Think of a corn or a callus like a rock, and this thick skin is a rock. And when you get pressure against it, it pushes the underlying nerves that are beneath, and it causes a lot of pain. When you have areas where you're getting all this pressure and pain, it makes it very difficult to walk. You can start walking on the outside of your foot, and then you can get other injuries, secondary injuries, compensatory injuries. Then corns and calluses can also be really dangerous in patients who have a loss of sensation or severe peripheral neuropathy, we would call that, or patients that have severe peripheral vascular disease where their circulation is compromised. Because when this skin builds up and creates pressure, if you don't feel it, you can actually get this buildup so bad that the skin can start turning black, and what you're really seeing when it turns black is blood, and that's when wounds occur. And wounds or ulcerations are basically a portal for bacteria. We're now losing our natural protective feature of our skin, It's a way or a portal for bacteria to get into our body and create infection. That can be really dangerous and devastating in those circumstances, because infections in the areas around the toes or across the ball of the foot, if they get down to the bone, can result in loss of the toes, loss of the foot, loss of the leg, and sometimes in severe cases, sepsis and death. Now, we can prevent that. Routine visits to your podiatrist in patients that have these high-risk conditions such as peripheral vascular disease or neuropathy or diabetes with neuropathy, they should be seen on a regular basis to have these corns and calluses shaved down. Because if you shave down these corns and calluses, you can prevent these underlying pressure spots from forming. We can certainly recommend certain shoes that will prevent irritation of this. You want shoes that have a lot of depth to them. You want shoes that are not going to squeeze the toes together. They're going to be a little bit wider. We can recommend sleeves or little sleeves that go over the toes that prevent the toes from getting irritated on the top, prevent the toes from rubbing against each other. On the ball of the foot or on the side of the foot, we can use orthotics, custom orthotics, which are devices that go inside of the shoe to take the pressure or offload the pressure from the area. And if conservative care fails, we can always pursue surgical treatment. You know, a lot of times we're able to manage this non-surgically, but there are definitely cases where surgery is required. In patients with these high-risk areas of pressure, we want to surgically correct the foot so we don't ultimately have limb loss, or we want to prevent these toes from being amputated, because once you amputate one area as a result of an infection, you know, you keep creeping up the foot, and we want to prevent that from happening. That's part of limb salvage and prevention. So we want to correct these deformities. And then simply, when you have patients that are young, healthy, middle-aged healthy, older healthy, they can have pain from hammer toes, the toes that are bent and they rub and they irritate on the top of the foot and they create these painful corns, and we simply need to go in and shave down or remove some of the bone. It's not simple as coming into the office and treating it one time and boom, they're gone. And that's the big misconception that people have. People are under the perception that they can come into the office one time and a corn or a callus is treated one time and it's gone, because the underlying anatomy is what causes these lesions. It has nothing to do with just the skin or just the shoe. It has to do with the way that the bones are rubbing against the skin and against the shoe. So you have to think of your skin like a piece of meat on a sandwich, and a shoe is one piece of bread and the bone is the other piece of bread, and that piece of meat is getting rubbed, and if it builds up enough, it can cause pain. And finally, we really recommend that people hydrate their skin on a regular basis. Keep the skin nice and moist and lubricated to prevent cracking. Cracking itself can cause pain. Avoiding barefoot walking as much as possible. So if you would like to learn more about corns and calluses, if you feel that you have a corn and callus that requires attention, simply click on the form on this page and request a consultation, or give the office a call and we'd be happy to see you. Thanks.